So without taking much more of time, and we thank everyone for logging in at a timely manner, I will start by introducing our moderators for today, who will help us to get through the event. First, I'd like to introduce Ms. Marie Pascal Poku. Ms. Marie is an investigator analyst at the Ministry of Labor Training and Skills Development. In her job, she's responsible for interpreting legislations, policies, and guidelines to access applications for the Ontario Immigration Nominee Program. Prior to this role, she was a special agreement officer at the Ministry of Children, Community, and Social Services. She was responsible for interpreting legislation, directives, and guidelines to administer funds to families with children with disability. Ms. Marie Pascal also serves as the chair of the Patient Advisory and Advocacy Council of the SCAGO. Welcome, Ms. Marie Pascal, and thank you for helping us today to moderate this session. On the same note, I'd like to introduce the second moderator, Dr. Susan Williams. Dr. Williams is a staff physician in the Department of Hematology Oncology at the Hospital for Sick Children. She also served the patient community with zeal and dedication. Recently, Dr. Williams joined the SCAGO's research team, providing intellectual contributions to so many projects, including the debut study identifying hospitals in need of education to provide optimal care for sickle cell patients in Ontario. Without taking much more of your time, I'd like to welcome again these great moderators. I will hand it over to them as we continue the session. Thank you, Ms. Marie, and thank you, Dr. Susan.
Thank you, Ms. Lanray, for this kind introduction. Like Ms. Lanray said, I'm currently serving as the chair of the Patient Advocacy and Advisory Council, and I'm really glad to be here. Today on the agenda, we'll start with just some land acknowledgement before we proceed with the panel presentations. But before that, actually, I think Dr. Williams, you would like to go ahead and just talk about some housekeeping rules. Sorry, Dr. Williams, you're on mute.
Can you hear me now?
Yes.
Perfect. Okay. So just the housekeeping rules for the morning. Everyone is aware that the session is being recorded. We ask that all questions be saved until after the panelists have all presented. So you can start to put your questions in the question and answer or the chat box throughout the presentations. And at the end of the presentations in the Q&A session, questions can be taken at that point. You can also ask your questions orally and simply indicate that you would like to ask a question or make a comment by raising your hand using the reaction buttons along the bottom of your Zoom icons. And thank you and welcome again to the session.
All right, now we will proceed to the land acknowledgements. We're grateful for the opportunity to gather, though virtually, on this land, and we thank the generations of Indigenous people who have taken care of this land long before other nation groups came. In particular, we acknowledge the traditional territories of the Ojibwe, the Anishinaabe, and the Mississaugas of the New Credit, whose territory is covered by the Upper Canada Treaties. We also acknowledge the contributions the Métis, Inuit, First Nations, and other Indigenous people have made in shaping and strengthening this province and this country as a whole. We also need to continuously educate ourselves about the colonial history of this country and understand how the wrongdoing of the past still impacts the present and the future. I encourage everyone at this session to actively seek information and take action. Thank you very much.
So at this point, I'd like to introduce our first speaker for the session, James Bradley. So James is the Transition Navigator with the Hemoglobinopathy Program, working between the two institutions, Hospital for Sick Children and the Toronto General Hospital. He supports teenagers and young adults with hemoglobinopathy with their transition from pediatric to adult care, including addressing aspects of transition readiness, psychosocial support, resource navigation, goal setting, and developing self-management skills. We have a monthly transition clinic at the Hospital for Sick Children, which James is the lead in organizing. And James' background is as an occupational therapist with experience working with both youth and young adults. So with no further ado, I welcome my colleague, James Bradley.
Thank you, Dr. Susan. And on this note, I'll stop sharing my screen so that James can share his screen. Thank you.
All right, can everybody see my screen there? Great. All right, thank you, Dr. Williams, for the introduction. So today I'll be talking about the transition to post-secondary school for youth with sickle cell disease. And of course, it's going to be a focus on accommodations in post-secondary school. So first, I'd like to just acknowledge the teams that I work with. So although I am sort of the lead of this transition program, I do work between Sick Kids and Toronto General Hospital, and then quite closely with SCAGO as well. So I'd just like to thank everybody for their support throughout the years. All right, so the outline for my presentation today. First, I'll be focusing a little bit on my Transition Navigator role, just to give you a bit of a background as to sort of where I stand in working with teens with sickle cell, especially as it comes to post-secondary school. I'll talk a little bit about the background, so sickle cell disease and academics and some of the functional impacts of that. And then I'll move into kind of what accommodations in post-secondary school are, and also how to register for those services. I'll move on there to talk about some other resources that are available to post-secondary students, with a focus on kind of what's available in some of the schools near or around Ontario. And finally, a bit of a summary and some tips for success. All right, so this is the general Transition Navigator pathway. So Dr. Williams gave a brief introduction there. So in my role, I do start seeing patients around the age of 12 years old at Sick Kids to introduce them to the idea that they will transition to adult care when they turn 18. So I do work between Hospital for Sick Children in the pediatric setting, and then Toronto General Hospital in the adult setting, continuing my work with patients around the age of 20, so spanning both pediatric and adult care centers. So in this Transition Navigator role, I work with patients with both sickle cell disease and thalassemia on disease knowledge and self-management skills. We do a lot of discussions around high school diploma requirements and different pathways to finish credits for high school. And then, of course, that moves naturally into post-secondary planning, which a lot of our patients that we see do pursue. We discuss employment and volunteer opportunities. And we do a lot of goal setting around all of these different topics. And then I also provide resources and referrals to other services that they may be looking for. And of course, system navigation, so helping them navigate when patients move from the pediatric center to the adult centers. And today I'll be focusing on that piece right there, post-secondary planning. So we know there can be a lot of challenges when patients do turn 18 and have to transition from pediatric to adult care. The first one being adherence to treatment plans and medication, while all these other changes are happening in life at the same time. So we know that can be a difficult time to kind of focus on adherence to treatment plans and medication. We know that emergency room visits and hospitalizations, often occurring in a new environment after transition, can be there can be quite a learning curve to that, and these can increase in that transition period. We also know that around the age of 18, there's increased life responsibilities, whether those be social, becoming maybe slightly more independent from family, and just kind of moving forward with different life responsibilities. And of course, multiple life transitions are happening at the same time. So we transition patients when they turn 18 to adult care. Of course, this often coincides with finishing high school and going off to post-secondary school, looking at different work opportunities, and then of course, social development and relationships as well. And of course, saying goodbye to pediatric providers. So a lot of our patients have been coming to Sick Kids for their whole lives or their whole time that they've lived in the Toronto area. So saying goodbye to some of those long established relationships can be difficult. And then on the flip side to that, also getting to know new providers and building trust in a relationship with them. So a bit of a background on sickle cell disease and academics. So as we just discussed, healthcare transition can be a very challenging process. And we know that support in the post-secondary setting can help address some of the functional impacts of having a chronic health condition like sickle cell disease and the impacts on academic performance as well. For a lot of the patients that I see with sickle cell, these impacts may include unpredictable absences due to managing pain episodes at home or being hospitalized, or also attending medical appointments. The impacts of chronic pain, managing multiple medical appointments, which in the adult setting tend to be less coordinated than they are in the pediatric setting. And of course, stress management and mental health management. So not only that being important for everybody attending post-secondary school, but living with a chronic condition and the pieces that can come along with that, of course, which we'll have another speaker talking on that today. And finally, the stigma. So a lot of people, may want to disclose their health condition or may choose not to disclose their health condition, which is a personal decision. And this can come down to a lot of feelings around, wanting to, how comfortable people feel disclosing that. So we know from the research that sickle cell disease can be viewed as an invisible chronic illness. So people wouldn't necessarily know by looking at anybody that they have sickle cell. We also know from the research that there's a lack of knowledge among educators on how sickle cell disease impacts people's academics. Another study interviewed high school students with sickle cell disease and found that 60% reported that it interfered with their school performance. I will say that in the conversations that I've had, I would think this number would tend to also be higher, kind of depending exactly how you're asking that question of how sickle cell is interfering with school. So before moving forward into some of the accommodations that I'll be talking about, I want to just go over some terminology. When we start talking about accommodations in post-secondary school, there's all sorts of different terms that are used and it can become a little bit confusing. So the term accommodation itself describes a change to an environment or a curriculum format or equipment that allows an individual with a disability to gain access to content or complete assigned tasks. So in colleges and universities, there's an accessibility office. So each college and university in Ontario has one of these. Actually, in Canada, any college or university in Canada has an accessibility office. And their job is to assess and recommend accommodations for students and also educate students on the school process and policy on how to use those accommodations. Now, of course, this word disability has already come up in the accommodation definition there. So this term is, it's a very loaded term that I know some people identify with and some people don't identify with. When we start talking about registering for things like accommodations, that term is used quite regularly. So I just want to kind of point that out that I know not everybody identifies with this term of having a disability, especially when it comes to sickle cell disease, but it is a term that we're going to see over and over again as we look at the accommodations that are available for people. So of course, there's many different definitions. I chose one that I think will kind of sum things up here. So a disability could be defined as any condition of the body or mind, an impairment that makes it more difficult for the person with the condition to do certain activities, so an activity limitation, and interact with the world around them, which is participation restrictions. And we know that disabilities can be episodic or continuous. So episodic meaning that there's periods of illness or impairment followed by periods of wellness. And then continuous being one where it's more on an ongoing basis. So knowing what we know about kind of the academic or the impact of sickle cell disease on academics, what support is available? So the Ontario Human Rights Code requires all colleges and universities to accommodate the needs of students with disabilities, unless to do so would cause undue hardship. So these accommodations are determined on an individual basis and done through the school's accessibility office. That is the only way to register for these services in the post-secondary setting, which often differs quite a bit from high school, where it's more, talking to the principal or the teacher about these things. To register, you do require medical documentation that is signed by your doctor and provided to the school. So legally, colleges and universities have to provide what are called reasonable accommodations. So a lot of times when I'm talking to patients about accommodations, they might say, oh, well, I don't want to be given an advantage. I don't need that, or, you know, that's not for me. So I found a couple of quotes that describe accommodations a little bit more, just to kind of give us a bit of a different view on what that might mean. So with accommodations, students with disabilities are expected to complete the same institutional and program requirements as other students. Accommodations do not give students an advantage over other students or alter the academic rigor of the course, program, or institution. To the contrary, it levels the playing field so that students with disabilities can become successful. So accommodations can be grouped into 4 major categories. The first one are teaching and learning accommodations. And an example of this would be note-taking if a patient's not able to be present in class. The second type would be something like an assessment and evaluation or examination accommodation. So this could be a private space to write exams, or if you're diagnosed with a learning disability, memory aids that you could use in your exams. The third type are environmental accommodations. So this could be strategic seating or seating in a private area to write exams. And finally, services and supports. So things like sign language interpreters, alternative format text, or assistive technology. So in working with patients with sickle cell disease, I've been in this role for 4 years. So that's 4 kind of summers of setting people up with different accommodation services in post-secondary school. These are some of the common ones that I've seen. So extensions on assignments for being absent for medical reasons, whether that's a pain episode, a hospitalization, or a medical appointment. Ability to reschedule exams if absent for medical reasons. Ability to reschedule exams to reduce the likelihood of stress triggering health issues. Private space and extra time to write exams, again, to kind of limit the stress associated with writing exams. And note-taking services if absent from class, although I am noticing that mostly notes are available online now, so I'm seeing less of this one lately. Now, I did put an asterisk beside 2 points there, specifically around rescheduling exams. So one thing that I have seen quite a bit over the years is that you still need to be very proactive with this. So if you know that you're missing an exam or need to reschedule for a medical reason, you really have to be proactive and tell your professor or instructor this well ahead of time. And they may even ask you to write the exam before the rest of the class. Obviously, things like pain episodes you can't plan for, or hospitalizations. So in this case, notifying them as soon as possible to set up alternative ways to do your exam. I do find that, you know, sometimes patients have come to me saying, you know, 2 weeks after an exam, oh, I missed it, but I have accommodations, so it should be fine. And sort of that far down the road, it can be difficult to backtrack a little bit and get those supports. Not impossible, but just a bit more difficult. So I want to go over the process for registering for accommodations. Now, every school has their own process. So really the key is just to review the school's website. So all of the information will be on the school's accessibility section of their website. So I really recommend going there as the first place. However, there is sort of a general process that I've noticed between the different schools. The first step being complete medical documentation. So the student has to sign and complete their details, and the medical provider also has to sign off on this. These documents need to be sent to the accessibility office and registered with their services. Following sending the documentation in, you need to meet with the accessibility advisor to set up your services for the academic year. Of course, a lot of this is being done virtually now during COVID. After that, they provide you with something called a letter of accommodation, which the student then gives to their professors each semester to outline which accommodations they have for the year. Again, with COVID, I'm noticing that a lot of schools are moving to an online system to do this as well. So accommodations are one of the major kind of supports that I do recommend all of our patients sign up for. But there are so many supports in the post-secondary setting as well, which I think often go underutilized. So an example of that is a summer transition or orientation program. So some schools offer workshops for students with disabilities to help them prepare for a life at post-secondary school, ranging from one-day events to week-long transition camps. Again, a lot of these being now switched to virtual events. You can book an appointment often with a learning strategist. So many schools offer this through the accessibility office to help students with disabilities develop strategies to improve their learning and study skills, which is quite a big challenge when starting in college and university, often quite different than high school. Most schools offer peer mentoring as well. So whether that's somebody that has navigated accessibility services that's in a higher year, that can help younger incoming students with navigating the process. And also peer tutoring or just tutoring services and academic support. So often there's peer tutors available who have taken first-year courses that are willing to and able to meet with people in first year to help them, navigate their courses and provide peer tutoring. And support in social groups. So lots of different social and disability-focused social groups as well. Now, again, each school is very, very different. There are so many different supports out there. So you really have to look at your school's website and find out what they offer. When putting this presentation together, I just took a quick look at one school, so Queen's University as an example. And these are some of the services that are separate from accessibility that they offer. So you can see they offer learning strategy development, regional assessment and resource center for people with learning disabilities. And this one I had actually never heard of before, something called Invisibilities. So you can see a student organization promoting awareness, education, and support of young adults living with hidden chronic illnesses. So, in doing research for this presentation, this is something I hadn't even heard of before, but it seems like would be a great fit for a lot of the patients that I see that are moving off to post-secondary school. All right, so knowing what we know about this process, how are we at Sick Kids and Toronto General supporting this process? Back in 2018, we did a quality improvement project. Kind of in the years leading up to 2018, we noticed that more and more students were coming to us with, patients were coming to us that were off to be post-secondary students with their accessibility paperwork. So we thought, this is something we should look into a little bit more. So what we did is we interviewed students with sickle cell that are attending post-secondary, and we also interviewed accessibility office staff from 11 different schools. We gathered feedback and advice on the process to register and use accommodations in post-secondary. And then we used that feedback to update our process in the clinic here and guide future patients that were going to be students. We learned 3 key lessons from this. So the first one is knowing what resources are available to you. So again, this comes back to, before starting school, make sure you really go through the school's website, accessibility services, other support services, and know what is available to register for, and also doing that early. Oh, no, that's the next point, registering early with appropriate documentation. So it does take a bit of time to, to print off the right forms, fill out the student portion, get your doctor to sign off on that, and then meet and set up your services. So I really recommend doing this early in the summer or before you start your school semester. So it does take a bit of time to set these things up. And we know that it's not impossible to set it up during the school year or after a medical event has happened, but it is a little bit harder to catch up, the pace being quite quick in post-secondary school. So, trying to set these services up later can be difficult. And the importance of self-advocacy. So in the post-secondary setting, there's likely less parental self-advocacy, which we might see a lot more in high school. And actually often in the post-secondary setting, I've had experiences where patients have told me that the accessibility office wouldn't even speak to the parent. They would only speak to the patient, or in that case, the student. So really kind of developing those self-advocacy skills to be able to talk to the accessibility office, let them know what your health condition is and what supports you need. So we were actually able to publish this study in the Journal of Pediatric Quality and Safety, and that's available for anybody to read. So if anybody wants to check it out, there's the link for it. And I also have it in the resource section at the end of the presentation. So since that time, the Transition Navigator, so myself, providing patients age 17 and 18 in sickle cell clinics with education and guidance for every student that's going to post-secondary or thinking about post-secondary. And then supporting patients in registering for these offices throughout the summer. So reaching out to patients and making sure everybody knows about how to register for these, and also looking at financial aid and scholarship options. And then ongoing support, during the first couple of years of college or university in connecting to services. So navigating difficult conversations with academic advisors or accessibility advisors, providing medical notes when they're admitted to hospital, and connecting to peer tutoring and things like that. Right, so a bit of a summary and some kind of tips for success. So it really is important to register for accessibility services early with the right documentation. You have to be able to describe your condition and what your needs are, and you really will be your best advocate in this setting. Researching your program and knowing what your school's resources are. and connecting directly with professors if able. So, the accessibility office sets up the services for you, but then it's the patient or the student's responsibility to meet with their professors to get the right supports they need during the school year. Of course, a lot is being done online now, and schools are adapting to this online approach as well. Consider other life transitions that you're having, while starting your post-secondary journey. So things like learning new life skills, learning to manage your medical appointments and medical care. A lot of patients that I see will also be moving to new cities to start post-secondary school. So developing, strong support systems and knowing where to go when help is needed in those new cities is also recommended. And of course, building a strong support network around you. So that includes family, friends, supports at your school, and supports within your healthcare team as well. So that's everything I wanted to talk about today. These are just some of the resources that I used throughout the presentation. The first and second one are both Canadian-focused transition to post-secondary for students with disabilities. So those are really great resources, and they have so much information on them. I really recommend everyone checks them out. And then, of course, the link to the article that we published on specific to sickle cell disease. All right, and that's it for me. And I think questions will actually be at the end if I heard that correctly. So thank you, everyone, for listening.
Thank you, James, for a great talk. And yes, questions will be at the end.
Sorry, James, if you can stop sharing your screen, I would like to share back. And thank you again for the great presentation. Thank you. For those of you that may know, the SCAGO has been working with the CKs and Toronto General Hospital for many years to actually support young people who are transitioning to post-secondary. And we're very grateful for the opportunity to continue to do this.
Yes, thank you again, Mr. Brady, on your presentation and on the useful tips that you've shared on helping people with sickle cell disease to navigate the post-secondary institutions and also the accessibility requirements. Next, we'll move on to another panel presentation led by Dr. Christian Durish. And Dr. Durish is a pediatric neuropsychology clinical postdoctoral fellow at the Hospital for Sick Children. She completed her PhD in clinical psychology at the University of Calgary and a residency in pediatric neuropsychology at Sickle. Her clinical work is focused on neuropsychological assessment of children and adolescents with various neurological conditions or medical conditions affecting neurocognitive functioning, including sickle cell disease. She also engages in psychotherapeutic intervention with children and adolescents with complex medical histories, as well as with parents of children with neurodevelopmental disorders. Her research expertise is in traumatic brain injury in children and adolescents, with a particular focus on examining the role of resilience in promoting recovery following illness and injury. Today, she will be presenting on mental wellness and post-secondary transition in sickle cell disease. So Dr. Durish, over to you.
Thank you, Marie, for that introduction. I'm just going to share my screen. Okay, can everybody see this okay?
Yes.
Thank you. Okay, so thank you all so much for having me here today and giving me the opportunity to speak about something that's very near and dear to me. Now, it wouldn't be a talk about mental wellness if we didn't first put words to practice. So I just encourage everyone to just take a moment, take a breath, get settled into your space. This is the beauty of being able to be virtual and working from home. I myself have a cozy blanket, so I just encourage that from everybody. So as a psychologist, I'm often tasked with consulting with patients, families, other practitioners, and the general public about mental health, which is so often focused on mental illness and how to cope when thoughts and emotions sort of become unmanageable. But the fact of the matter is, the vast majority of us actually do function quite well when it comes to our mental health. We know ourselves well, we know what to do to cope. So rather than merely focusing on coping with problems, I spent a lot of my research and my training and my clinical work on trying to understand wellness factors that can be harnessed to help mitigate problems from arising in the first place. That age-old saying goes, an ounce of prevention is worth a pound of cure. And I think that saying holds really true when it comes to mental health. So I just want to start off by congratulating everyone here, first of all, on all your achievements and your decisions to move on to post-secondary school. Finishing high school is a huge accomplishment, and transitioning to university and college can be a really huge step. Now, many of you are likely feeling a lot of emotions about this upcoming transition, not just about switching schools, but also about transitioning to adulthood and all the joys and stresses that can come along with that. Transitioning to post-secondary can be really exciting. It brings out an opportunity to gain more independence, the opportunity to learn not only about your chosen area of study, but also about yourself, figure out who you want to be, and build relationships with people you want to surround yourself with. This is going to be an adventure unlike anything you've experienced up until this point. And it's going to be probably incredibly exciting for you. And transitioning to post-secondary can also be really scary. Anticipating change is always unnerving, and change brings about fears of the unknown. But over and above that, it's not only is it worrisome to sort of leap into this unknown, but you can also anticipate very real stressors that you're likely to encounter. Academic load is going to be bigger probably than what you've experienced in high school. Financial stressors are real. School is expensive, and all the money that comes with it, if you're moving outside of home, for example, it's very expensive. Social stressors, family and personal stressors, and also health stressors, right? Managing your medical regime, pain crises. These are all very stressful situations to go through as you transition to adulthood. And what I want to say is not only are these anticipated stressors expected to bring on anxiety, but this is normal. It's really normal to feel uneasy about transition and change. And I'm not here to wish away any of this uneasiness for you. Actually, my goal for this talk is to help you welcome all of these feelings rather than try to resist them, because they're part of being human. So when I think about mental wellness, I think about what are the components of living a fulfilling life. This doesn't mean, how to be happy or how to experience joy or how to avoid pain. This is absolutely not what mental wellness is. Mental wellness is more about how to notice and welcome the spectrum of emotions and experiences that come with being a human, and how to live our life in accordance with our values, despite challenges that are going to inevitably arise, and how to be kind to ourselves. So each of these three components can be labeled mindfulness, values, and self-compassion, and I'm going to go into each one of these. So the first component here is mindfulness. Mindfulness has been kind of a buzzword that's gained a lot of traction and popularity over the past decade. Maybe when I say mindfulness, maybe images of like yogis or people sitting on mountaintops, cross-legged come to mind. But really, mindfulness is a concept that's been around for thousands of years, and it dates back to old Buddhist philosophy. All it means is directing your attention to what you're experiencing in the moment and absolving judgment about that experience. I have 3 words here, be here now, you can see. And you'll notice that each word has a period at the very end of it. And this is because each word can actually stand on its own as a key component to mindfulness. Be, just as you are. Don't try to change a thing, just be exactly as you are. Here, in this space, in this chair, in this room, in the city of Toronto, here, physically. Now, in this moment, in this present time. Now, our brains have evolved to have what's called the default mode network. A lot of my training is neuropsychology, lots of information about the brain. The default mode network is actually a system of connections in our brain that kind of kicks in when we're at rest or doing nothing in particular. We think forward to what's coming, or we replay past experiences. And all of this has evolved really to protect us. Our goal as a human species is to protect ourselves so that we can stay alive, right? So we think about our past experiences in order to learn lessons that will better prepare us for the next time. Or we envision the future in order to prepare ourselves for what's to come. Mindfulness is about noticing when our minds have kicked into the default mode network. It's actively bringing it back to the present moment. It's not always about staying in the present moment or even fighting with our minds for doing the thing that it's evolved to do. It's noticing when we've drifted and gently pulling it back to the present moment, just as you would a wandering puppy. Come here, little guy, come on back, nice and gently. And it's something to be practiced every day. In order to train your mind to be able to notice that present experience, you have to be doing it regularly to physically, literally build those connections in your brain. It doesn't have to be some sort of formal meditation practice. You can just practice mindfulness simply by paying attention, even during like a routine that you do every day. So take, for example, maybe having a shower. Next time you're in the shower, try to just engage each 5 of your senses. Notice the feeling of the water on your body. Notice the smell of the shampoo, the sounds of the water falling around you, the shape and texture of the shampoo bottle, the soap. Just notice and pay attention in a curious and non-judgmental manner, as if you were like an alien coming from outer space and just experiencing this for the first time. Get curious and notice. Now, the next component is values. What do you actually care about? And how do you know? Now, on the slide here, I've capitalized actually, because many of us engage in things kind of on autopilot without really thinking about what it really means to us, or like, what is it about that thing that we care about? So let's take, for example, maybe say you're a soccer player. You value soccer. Well, what is it about soccer? Is it the true love of the game itself? Is it the rules and the way the ball moves on the grass? Is that what you care about? Or maybe is it the exercise, the physical movement, the endorphins? Maybe that's what it is that you care about with soccer. Or maybe it actually has nothing to do with the game, but it's actually more about the social connection and the camaraderie that comes with sort of being a part of a team. So I really encourage you to think about your values and really explore what the underlying drivers are for that value. Because inevitably, things are going to come up that get in the way of your values. Maybe you're fighting with a team member, for example, and you think, no, I'm just not going to go to practice today. So you're sort of avoiding it. Or maybe school is really, really heavy and you just don't have time. Or you're experiencing a pain crisis and it gets in the way of being able to do the things you care about. But figuring out what the true underlying value is going to help you not only to prioritize those values, but also to bring about ways to achieve engagement in that value in different ways. So if we think about soccer as a value, then if schoolwork or an after-school job maybe gets in the way of soccer, then that's it. You just can't engage in that value. Too bad, right? But if you really explore what the underlying value is, maybe it is that social connection. There's 100 other ways that you can achieve that value. The goal of living well is not eliminating barriers to engaging in values, but actually engaging despite those barriers. Now, the third one is self-compassion. We are so hard on ourselves as humans. Now, as humans, we've evolved to protect ourselves from harm and death. That's what our brains are meant to do. So we have evolved to punish ourselves for mistakes to make sure we don't do them again. This has turned into some unnecessary harshness that we put on ourselves, and it doesn't really serve a purpose. So, for example, research has shown over and over again that punitively punishing a child doesn't actually serve to change behavior. So why do we do that to ourselves? I want you to think of a time right now, just where you said something you really regretted, something majorly cringy, okay? What thoughts came to mind when you first reflected on that? Maybe it was something like, oh, you idiot. You came off so rude there. Oh my God, I can't believe you would say that. How are you ever going to make friends if you talk to people like that? Pretty harsh, right? And not only the words, but think about the tone even that you use with yourself. Now imagine that a friend came to you and said, oh my gosh, I said something, I really regret saying that. It was really, really cringy. What would you say to your friend? Would you use those same words that you used on yourself, that same tone? Probably not. Maybe you'd say something more like, that's too bad. Yeah, I've said something like that before. I've definitely said things I regret. We all say things we don't mean. Oh, sorry that happened. Right? You'd be kind to them. Your tone would soften. You'd offer up some common humanity. Because the fact of the matter is, we all feel feelings. We all feel these feelings, these really challenging feelings. It's part of being human. And we all screw up. It's part of being human. So self-compassion is really about just offering yourself the same kindness that you would a friend. It's about noticing that painful moment and going easy on yourself about it. It's asking yourself, what do I need in this moment? What do I need right now? Maybe you need to take a walk to clear your mind. Maybe you want to take a nice warm bath. Maybe you just want to veg out and watch Netflix. Maybe a self-hug or a physical hug from a friend. Checking in with yourself to see what you need, just like you'd check in with a small child who's hurt, sad. Okay, so I've gone into some key components of mental wellness. I'm going to switch gears a little bit. What happens when life stressors get to be too much and you're feeling really overwhelmed? Maybe you're feeling too bogged down to engage in values. You're experiencing significant pain. This is when it starts to affect your functioning every day. So what do you do? What if you do? How do you cope? So before talking about coping, I think it's important to first recognize and bring awareness to where we are in terms of level of functioning. So here's a chart that I made to describe different zones of functioning. So you've got safe, challenged, and overwhelmed. First, in the middle, the blue, safe. Safe is all about keeping ourselves protected, right? It's that fight, flight, freeze response. Maybe you're feeling super overwhelmed and all you can do is lay in bed and binge watch 15 episodes of Squid Game. That's freeze. That's fine, right? Maybe you got in an argument and you're lashing out at someone. That's fight. Maybe you're avoiding going to that party because you're worried about someone that's going to be there that you really don't want to talk to. So you just sort of avoid going out altogether, right? That's freeze. So whatever it is, the mode, fight, flight, freeze, it's the whole purpose of safety, right? And it's there for a reason. Safety is a good thing. It keeps us safe. So it's a great response. But we don't learn or grow much in safe mode. We can't stay there all the time. We can't stay curled up in bed watching Netflix all the time. It doesn't help us grow, right? The goal of living well is to grow and learn and experience the world around us. That's the challenge zone. Now, challenging yourself isn't always super, super comfortable, right? It comes with risk. It comes with discomfort. You do things, you play that soccer game, even though it physically hurts sometimes, but you do it because you care about it and you enjoy it. So it's engaging with values despite discomfort. Now, sometimes we go about in the challenge zone, things are great, but then things can become too much and we get overwhelmed and we get pushed into that overwhelm zone. Now, the difficulty with being in the overwhelm zone is that you can't just go from overwhelmed back to challenged. You don't just go, oh, like you just get reamed out by a friend and then you go, oh, okay, well, I'm just going to play a game of soccer. Or you're experiencing a pain crisis and you go, okay, well, that's great. I'm just going to go back and do my homework right now, right? You go into safety mode first. You fight back with that friend, or you take a moment to kind of just relax to yourself, or you walk away, you do some self-care, you do whatever you need to do to kind of bring yourself back down, right? Whatever that fight, flight, freeze response is. We constantly cycle through these zones all the time. We're constantly doing it. The key is to notice where you are on this chart so that you can know what you need in that moment. Hopefully we can keep ourselves in that challenge zone as much as possible, but really it's not like we just experience all the spectrum of everything. So we bounce around these zones, and the goal you can kind of notice when you're about to get overwhelmed so that you don't actually get into that overwhelm zone. Then you're going to stop yourself from having to go overwhelmed all the way back to safety and then back to challenge, right? You can't just go overwhelmed back down to challenge. So what do you do if you're feeling really overwhelmed? You bring yourself gently to safety. Practice mindful grounding techniques. You can take a moment. Grounding techniques are just bringing you present in the moment. So you can take a moment to engage all 5 senses, no matter where you are. I call this the 5, 4, 3, 2, 1 technique. What are 5 things I can see right now? What are 4 things I can physically feel? I can feel this chair, the clothes on my body. What are 3 things that I can hear? I can hear traffic of the gardener because I live above the gardener. I can hear my own voice. What are 2 things that I can smell? Maybe breakfast that I cooked, the smell of my laundry detergent. What's 1 thing I can taste? So engaging all 5 senses. Maybe you're in extreme pain and you actually don't want to put focus on your body right now. You can still use grounding techniques to bring your attention away from the body. So one of the great ones I like to use with patients is just pick a color, any color, green, and scan your room, scan your environment, try to find all the green things that you can. Then pick another color, yellow, and so on. Keep doing that, right? The other thing that I would encourage is mindfulness apps. So things like Calm and Headspace, these are really, really great resources to use to help hone your mindfulness practice. Really helpful. Or you can talk to a friend or a family member or a therapist. Sometimes just venting is a great way to unload and to bring yourself down and manage that distress. Don't cut yourself short. You know yourself really well. And so sometimes just talking out loud gives you the ability to think about what you need and move towards it. And then the other thing is, what do I need right now, right? Just thinking about what is it that I need. Just get in touch with yourself. Now, when to seek help, right? Sometimes we can actually get stuck in that safety moment and we have a hard time moving from safe to challenge. And this is when it interferes with functioning, right? And at this time, this is the time when it's really important to seek help. Now, ideally, I'd encourage mental health check-ins at any point in that sort of chart, challenged, overwhelmed, safe. I'd encourage checking in. Mental health check-ins can and should be a regular part of your routine, like going to the dentist to have a cleaning, right? It should be that. They don't have to wait till you get a cavity, for example, right? But people don't always have access to mental health, just like we don't always have access to dentists. So those practitioners are not readily available for people. But when you notice that you're stuck in safety, it's interfering function. So like with your functioning. So maybe you're noticing that you're avoiding doing anything, or you just don't have pleasure or joy from those activities you used to care about. You're just stuck in bed and you can't get motivated to do anything. Maybe you're not even showering regularly. When you're stuck in safety mode, it's time to reach out. If you have a cavity and your tooth is in major pain, you're going to the dentist at that point. So that's what I'd encourage, to really sort of to reach out. Now, where can you get help? For starters, every school, every college or university has mental health support for students. Your tuition goes towards this. You pay a boatload of money towards tuition. Use it, reach out. That's what they're there for. It's expensive to pay for tuition. And so definitely take advantage of the mental health resources that are available on campus. The next option is to call a hotline. So crisis hotlines are really great. They're easy, they're free, they're quick access, and they can be anonymous as well. Here are some numbers that you can call that I have on the screen here. This is Distress and Crisis Ontario, or call Crisis Services Canada. You can also just Google crisis hotline in your area to find the number to a hotline designated for your specific area. Now, if you think it's really bad and you don't feel like you can keep yourself safe, call 911 or go to an emergency department. Absolutely want to keep yourself safe. The other thing you can do is reach out to your family physician. We live in Canada and we have free access to physicians, family physicians, or a walk-in clinic even to meet with a physician if you don't have a family doc. Let them know you're struggling and they can help get some supports in place for you. There's also psychologists, psychiatrists, psychotherapists, social workers, crisis counselors that work in your community. You can reach out to them. There are free mental health services in the community. Sometimes they have really long wait lists, unfortunately. Or you can reach out to private practices. Private practice is generally fee for service, but some psychologists will offer services on a sliding scale if you can't pay the fee. But the worst thing that would happen is they would just refer you or help set up some more affordable supports for you. So definitely reach out. Okay, and with that, I just thank you all so much for having me today, and I wish you all the best in your futures, and I'm happy to take questions during the question period.
Thank you, Dr. Durish, for these helpful tips on mental wellness. We will move on to the next section or segment of our webinar, which will be panel presentations on people with sickle cell disease, just sharing their experiences, their post-secondary experiences. I don't know if Dr. Williams, you would like to start?
So we have two presenters who have agreed to share their post-secondary experiences. Steve Kindo, who graduated from McMaster School of Nursing in April. Congratulations, Steve. And is currently working as a registered nurse with the Forensic Psychiatry Program at St. Joseph's Healthcare in Hamilton. And Ojina Mitchell, who I will let introduce herself with her background details.
Hi, everyone. My name is Ojina, but people call me Gina. I'm currently going to Wilfrid Laurier University. This is my last year. And I am going to school to become a lawyer. So I'm currently studying criminology, and I'm going to be sharing my experiences today. Feel free to ask any questions if you guys want me to go a little bit more into detail. I'm always open to doing that. And I just want to say thank you for having me today as well. So let me get started here. So applying to university, I did that in 2017. And before starting school, I would suggest, like James said, applying to the Accommodation Center before school starts. And that's kind of what I did. I met with the Transition Navigator at the time, and we went through the application process together, and we faxed it off together. And my school reached out to me, and we had a meeting about what kind of accommodations I thought I needed and what I was comfortable with sharing with my profs. And we kind of made a plan of about what we would like to do in terms of if I had a period of time where I would be away from school for a while. And with doing that, it kind of really just helped take the stress off of like transitioning into like the whole adulting scene. And I would suggest like meeting with your consultant once before before the semester starts, just to kind of go over what kind of has changed and like if any courses that you decided not to take, if you're going to take a reduced course load or not. I decided to do a reduced course load when I first started university, just to kind of test the waters and see what I was able to handle and what would be difficult for me. And then I kind of worked my way up into a full course load. And that was really helpful, kind of seeing like managing, because at the time in first year, I was living on campus away from home. And that was like my first time ever doing that. So I just wanted to kind of ease into it and just not feel so overwhelmed. And with doing that, like meeting with my consultant before the semester starts, I was able to kind of keep that open communication. And I felt it was kind of easier with the open communication for that consultant to understand me and kind of figure out how they could help me. So in doing that, I was able to like share my syllabus with her and she would help me kind of pick courses and let me know which professors would be a little bit more accommodating and which ones the center had a little bit more trouble with. And anytime we had kind of like a conflict or something that I felt like we had a miscommunication about, I always set up a meeting to kind of go over how I think we can move forward. And I like always try to do it in a timely manner and like without trying to seem rude or anything along those lines. And if I felt that I still wasn't being heard in terms of accessing my accommodations, I always opted to kind of have someone from the support team, like the social worker at Toronto General Hospital, or Larnie come and help me, or my mom. You can always have like an external source come in and kind of advocate for yourself if you also do not feel like you're doing it appropriately. And you can just kind of tell your consultant, like I give so-and-so permission to kind of listen in on our conversation. And then like doing that, it helped me because I never really communicated or advocated a lot for myself before starting university. And so when I first started, I had a lot of, I guess, miscommunications and kind of learning how to do that. And then once I kind of had help, I was able to learn, and I completely advocate for myself all the time. And especially since we're going online now, we just send a quick email and she'll be like, okay, yeah. And I think that's kind of really important. And as well as when you connect with this center, they also connect you with a lot of services that are appropriate, like the peer tutoring. There was a time where I missed a lot of school, and I had a math course for that semester, and I was kind of freaking out about it. And I connected with my consultant, and she was able to help me find a tutor to kind of help me catch up and teach myself before I could go back to class and so forth. I also want to mention that since we are kind of venturing out into the adulting world with like the extra stress of having to manage our health, I think it's very important to kind of be proactive in that. I noticed that going through my university experience, exam seasons and midterm seasons were kind of the time where I had most of my flare-ups. So I always tried to be proactive in maybe doing work a little bit earlier and making sure that I didn't get stuck into that whole mentality of feeling like I had to choose between school and my health. I always tried to kind of limit pulling all-nighters and kind of stuff like that, just because I know that stress is kind of not doesn't really work with us. And I always try to kind of keep up with eating meals and all that. And if I ever felt like I was being overwhelmed, my school did have free counseling that I would go to and just kind of make sure that I was okay, like physically and mentally, so that I could be healthy in terms of getting work done and staying on top of stuff. I think that kind of sums up my experience. I don't want to go too long because of time, but like I'm always open to kind of going into more detail about my experience and like what I included in my accommodations and so forth. But thank you guys so much.
Thank you, Ms. Ogina Mitchell. Just right before we proceed to Mr. Kindle's presentation, I'd just like to give a kind reminder to all the participants who are joining us today to please, if you have any questions, please start to post them now in the chat or Q&A box, so that by the end of the session, we'll have some time to answer questions and continue the conversation. So thank you very much, everyone, for your understanding on this. And Mr. Kindle, over to you.
Thank you. Just a small question, Monterey. I know you're sharing your screen, but could you maybe unshare your screen so people can actually read on their full screen? If possible. If not, no worries. I'll just get started. I just wanted to thank all the presentations we've had so far. We had one on mental health, another one on accommodations. It was great information. I really do think that a lot of our young students and parents will really need this, because looking back, those are things that I wish I would have known when I was starting school. But what I kind of want to talk about is the fact that everybody's journey with accommodation is different. It depends on what school you go to, your health, and many different factors. So I went to McMaster, and over there it's called Student Accessibility Services. So I had heard about it in first year. I knew kind of what they did, but I didn't really take it too seriously. I thought, you know what? I'm in good health. I'm going to my classes, doing my assignments on time. Grades are up. I don't really need it, you know? But that was a mistake. That was a mistake. It was only until my second year that I even reluctantly approached my academic advisor, who referred me to the accessibility counselor, and we just talked. I listened, and he kind of went over what they can do for me and what I need to provide. So yes, there was some paperwork, there were a few meetings, but at the end of it, he said, okay, Steve, given everything that's been shared, this is what I can do for you. We can give you extra time on your tests, on your assignments, and he gave me a form to complete through which I could access extra funding through WhatsApp. So not bad, not bad. I got extra time on my exams, on my assignments, extra money. Great, you know, it doesn't get better than that. But the thing is that I never used any of my accommodations, not once. I never used it. I never took extra time on my exams. As a matter of fact, there's usually my trust. I never asked for extensions on my assignments because, you know what, I just get it done. I mean, the extra money, yeah, was nice. But I never used any of my accommodations. And one can say, like, Steve, was it really worth it? What was the point of jumping through all those hoops and getting this signed, that paperwork signed, paying your doctor to sign this and that? Was it even worth it? And I think yes, it was worth it. Because of a simple reason. What if? You know, I was healthy throughout all university for the most part. But what if I'd gotten sick? What if I got hospitalized? What if I was unable to attend classes? What if I couldn't complete my assignments? What if? What if I couldn't show up to an exam? Like, what would I do if that would have happened and I didn't have my accommodations? And that's something to think about. Because would that then be the time to start chasing after doctors, chasing after your academic advisor, counselors, getting papers signed to get your accommodations in place, talking to your professors about why you can't do X and Y by this and that day, all while you're sick, adding on to your stress? Would that have been the time? Of course not. So the point of accommodations is really for prevention. It's really for what if, getting ahead of the ball. And that's something you have to do, especially when you have sickle cell, a disease that is. So another point that I really wanted to talk about is that most of us have sickle cell, but we all experience it differently. So some of us haven't seen the inside of a hospital in years and probably won't for many other years, right? For others, it's unfortunately a regular occurrence. Some of us on some days might even forget that we have sickle cell because we're good. Go to work, hang out with friends, exercising, we feel great. But others might not be able to go a week without feeling unbearable. It's a sad reality, it really is. So one thing is clear though, whether you're healthy or you're less healthy, we can't predict how sickle cell will affect in the future. course, it's a disease that has cumulative effects on our body. So we can't predict how we will fare a year from now, or 2 years from now, or a month from now. So that's something that we need to be mindful of and we need to prepare for. So as you know, many here have already gone to university. Some are planning on going to university, some have been to college, some are planning on going to college. And I'm sure you know, it can be stressful for a regular student. It can be challenging. Professors that are maybe not understanding, maybe there's family issues, maybe there's financial issues. There's so many things that can pile on and make it more challenging. But on top of that, when you have sickle cell, there's that added layer of jeopardy, right? Your health. And that's something that you need to navigate, you know, health as well, so that you're healthy, you have nothing. What's fun of going to school if you're too sick to work, you know? So you need to manage our health. There's that added layer of jeopardy. So if we want to be successful in our studies, we have to take account of that. We have to be accountable, organized, you know, take care of our health, and think of what if. What if I am sick? What if I'm unable to complete this task on time? Okay, maybe I'm unable to complete an essay. I'll get 5% off. I'll still submit it later. But you didn't have to. You could have not had the stress of having to pull an all-nighter. And Lord knows I've pulled many all-nighters that maybe I didn't have to pull if I would have actually used my accommodations properly. But what is the cumulative effect on us throughout a potential 4-year program or more, if that's your case? So to those who haven't already done so, don't be like me, you know, humble yourself if you have to. Go sit down with your academic advisor, let them refer you to the proper channels. Sit, listen, talk, see what they can do for you. You know, I got extra time on my assignments that I never really used. Like, I got extra money, which I definitely spent. But see what they can do for you. Maybe they can do more for you. Maybe they can do less for you. But just go in there with open minds and see what can be done. That way you can get ahead of the ball or be ahead of the curve, whatever the expression is, in case something does happen. So we talk about achieving success. You know, achieving success. It's the title of this sorry, what's giving me title of this session. But how do you achieve success, right? In order to achieve success, you have to use the tools at your disposal. You know, I think James was talking about it during his part. And so the accommodations is not about giving you a leg up, but making it a level playing field, right? So that insinuates that as somebody who has sickle cell, we may already be disadvantaged in a way, right? So if you want to achieve success, you have to make sure that you're able to engage with school on a level playing field, have a real chance to be successful, to put your best foot forward and to study to the best of your abilities. So, I mean, like, here's the thing. For me personally, my program was 4 years, but it didn't take me 4 years to do it. It took me longer than 4 years, you know? And of course, there's many factors that played into that. But maybe if I had been more prepared, more aware of the resources and tools that were available to me, maybe it would have only been 4 years, you know? I can't say that for certain, but I can definitely say that it would help. So it's just really important for us, students, parents, mentors, to be mindful of the fact that there are many resources available. And it may be more or less than what I had, but you never know until you ask. And exploring the options that are really available to you is what will enable you to achieve success. Thanks.
Thank you, Mr. Kindle, for sharing your experiences and some very helpful tips. Right now, we're moving on to the segment of our Q&A segment. While we await a few more questions, I would like to read something that was posted in the chat from one of our participants, Katrina Moulton. I am so happy that attention is paid to helping fellow warrior youth to navigate and succeed in their post-secondary studies while living and coping with sickle cell disease and other stuff in my life outside of school. I had to do all of this on my own back in the 90s, and while I made it work and I did get what I sought, it was very, very difficult to achieve. Imagine what I could have achieved if I had accommodation program already set up. I pray that more students will become aware and, if required, that they use services as needed. Though it seemed like it was a longer process for me, it wasn't really having medical accommodation did help me to achieve my goals and help take a lot of the stress off of me while I tried to experience and enjoy an active or as active as I was able to have while attending university. So they were just sharing their experiences and the lack of resources that was available back then as opposed to now. And they were just very grateful for the types of accommodation resources that are available to students now. But before we proceed to asking questions from the participants, I actually have one question, or some question I would like to pose as well. And I know that Ms. Ojina Mitchell shared some of her experiences with advocating for herself when she was in university. So Ms. Ojina Mitchell, my question to you is, if you have any tips that you want to share on advocating for oneself as a student with sickle cell disease in post-secondary education.
I guess like I'm a real advocate of like open communication. A lot of the consultants that I did come across with didn't know what sickle cell was. So it kind of it got kind of frustrating at times because I'm like, at my school, we had a lot of consultant turnover. So like in my experience, like basically every semester I had a new consultant, which made it kind of difficult because I would go through the whole process with my previous consultant and I would tell them, hey, this is how sickle cell affects me. This is kind of what I need to help me succeed. And it would go like all down the drain next semester when I got a new consultant. So that's why I like suggest like meeting with your consultant and kind of having that open communication and like building that friendship. And when you build that friendship, I feel like they're more open to understanding and they're like, oh, okay, I didn't see sickle cell like that. I didn't know. I'm sorry if I did this before. And it really helped. Like, so now I meet with my consultant every semester just to make sure we're on the same page. We come up with a new plan if there needs to be any changes. And I haven't had any problems with that. I think like, you know, you shouldn't be afraid to like ask for extra help if you need to. And that's important because like sometimes I don't like asking for help. And once I kind of grew out of that, it was just a lot easier to kind of, there was a lot less stress of having to feel like I have to do this by myself and so forth. But that's kind of like always trying to kind of connect with people. You don't have to feel like you're alone or and whatnot. So I would suggest that kind of just try to reach out whenever you need to and always ask questions. It doesn't hurt. You never know until you ask and so forth. So
there's a question in the chat before the Q&A questions. So this question I think is directed to James, which was for students who attend post-secondary institutions outside of Toronto, are you able to connect students to medical supports, hospital, physicians, mental health services in those communities? So other cities that are equipped to take care of patients living with sickle cell disease.
Yeah, so that's a good question. Thanks for asking it. I can't see who it came from, but thank you for asking that one. So definitely, we do at the time of transition or when somebody's moving away for school, we have those conversations of, you know, when it comes to the sickle cell care, it sort of depends how much follow-up and how much is needed for that individual person. So that's often a conversation done with our adult hematologist to determine if they need a referral to a hematologist in whatever city they're living in. So let's say they're going to school in Montreal or Ottawa or somewhere. You know, do they need a hematologist in that area? Will they need to be going for appointments every few months? Or would they prefer to just come to see the doctor at Toronto General when they're back over winter break, March break, or sorry, reading break, or summer break, and then planning around those things. So the hematology care is one thing. So we kind of determine that on an individual basis. Hospitals, absolutely. So every team that I work with that is moving away, try to have that conversation of, you know, where is the closest hospital in case you need emergency support, and how are you going to get there? Pharmacies, so where are you going to get your medication? And then other supports, kind of whether that be mental health or otherwise. I am generally, you know, less familiar with some of the supports in the different cities, but happy to do research with patients and connect them to what's needed in those areas. So it's sort of a combination between referring for the services that are needed while also scheduling appointments at the adult site at Toronto General when people are back over their breaks from school.
James, I have a follow-up question which ties in a little bit with that. So Steve and Gina and you highlighted in all that you've said about the importance of planning ahead and getting ahead of the curve and doing things early and connecting with accessibility services. Steve mentioned having to pay for a physician to sign off on a letter or note in terms of being eligible for accessibility services. Is that something that would be also done if they're going through the adult clinic? Is there a way to avoid that cost for letter completion?
So yeah, I mean, a lot of just my experience in general in the healthcare system is that, you know, a lot of doctors' offices will charge you for things like completing notes. I think that in our program, that's something that, you know, the doctors do rely on the fact that I'm around to kind of fill those out. So we don't charge our patients for that kind of thing, but I think that's just a general healthcare system thing. Yeah, so I would say, you know, if you're able to get in touch with your hematologist, that's probably the best way to start, because in that way, maybe there's a way to get around that fee. Yeah, so that's a tricky one as well, but I would say ask around, right? If you're just going to a walk-in clinic or a doctor that's not familiar with you, I think quite often they even have signs in their lobbies that say, you know, any kind of note to be filled out will cost X amount of dollars. Yeah, so I hope that answers that question.
Yeah, I think it's a really great point because, again, it's the benefit of planning ahead. Because if you're getting a physician in the hospital to fill it out, you're not going to get a bill for it. They will complete that form for you free of charge as part of hospital services. If you're going to go to a family physician or a walk-in clinic, there's going to be a charge. So again, the big benefit of really planning ahead is highlighted there.
Yeah.
I have a question while we're waiting for some more questions to Gina or Steve. So you both talked about being very well aware of the accessibility services on your campuses. How challenging or how difficult was it to develop that awareness? Was it something that you had planned for and so you were looking, or was it very easy to find on the website, or did you walk by the building very easily on campus? Just if you could share that part, I think would be helpful for folks.
Thanks to go first. Personally, for me, it was easy to access and easy to find. And once the process started, you just had to get a few forms signed, and you had a meeting and you were pretty much on your way. I hope everybody's experience will be as easy as mine. The only thing to keep in mind is that you have to renew it. I think it's either like every semester or every year. So it's not just set it and like forget about it. You will have to revisit it, and I think provide new paperwork, I think every year or every semester or something.
A follow-up question for you. Once you had accommodations in place, and Steve, you said you didn't ever have to use them, but did you feel any roadblocks to having professors or instructors actually adhering to the accommodations if they were going to be requested? Was it an odd thing, or was it something that was very much part of the school culture?
I find that because I was in a nursing program, like almost all my teachers were nurses, so they had healthcare experience. They mostly kind of knew what sickle cell was. So just from that perspective, Oftentimes, I didn't even have to mention my accommodations. I'll just say, like, hey, I have sickle cell, might be hard to make it here at this time on certain mornings, and they just understood. Now, of course, everybody's experience won't be as positive as mine, so it's definitely something to keep in mind, and to mention, not necessarily just at the moment when you need it, but sometimes even from the outset.
I can jump in here. My program was a criminology program. And so a lot of my teachers and my professors didn't know what exactly sickle cell was. So I did kind of have difficulties in like accessing my accommodations. So like, I remember this one time I was away for school for a little bit and I had this prof refusing to let me make up the missed assignment. So I just kind of sent him an email and I kind of included my accessibility consultant, and we were able to kind of talk out a new plan or a new assignment. It does, like, it was not gonna lie, it's really difficult sometimes, and especially because like you have all this documentation, you have your doctor's note, and sometimes some profs are just kind of like, you missed it. But some profs are really able to like, or willing to work with you. And I had some profs come and say, hey, I can't let you redo that assignment, but I'll give you another assignment to weigh the same amount and we can just go from there. I think like trying to like reach out to them and kind of including your consultant so that it's kind of like, we all can see what we're talking about. We all have our own documentation. Like I can see that I received this email from you on this date, and like just kind of really kind of everyone be included so there's not a miscommunication and there's no like ball drop in and saying, oh, I thought, this was supposed to be due this date or whatever. Like it's difficult, but once you kind of have that open communication and include everyone, it's doable, and the process will be flexible with you if you always get a doctor's note. I had one time a consultant kind of say, no, you're good. We don't really need a doctor's note. We have all this documentation about how your illness affects you. And the prof kind of was like, no, I need a doctor's note. I know you have this documentation, but I need a doctor's note saying you were ill from this time to this time. So just always opt for a doctor's note and just, again, kind of try to keep everyone included in saying, hey, this is what's going on, and so forth.
Thank you, Ms. Mitchell. There's actually, okay, so there was actually a question in the Q&A box about like if there are any ideas that you want to share, either you or Mr. Kendall, on how we can bring more awareness of sickle cell anemia in post-secondary institutions.
I think for me, in terms of how to bring more awareness, is that I'm always like open to kind of talking about it, just because I feel like we can't really blame others for not really knowing or whatever, because they're not grown up in an environment. Obviously, it does affect more minorities than it does the majority. So whenever people kind of asked and said, hey, like, I don't really understand this, I try not to get defensive about it. And I'd be like, yeah, like, like sometimes I can't do this and that's okay. I'll find another way to do it, or so forth. And I always try to kind of like, in terms of profs, like before the semester starts, I have like a note in terms of like my accommodation. And like, I kind of send them a letter saying, hey, I'm going to be taking your class. This is kind of what I have. I have sickle cell. This is how it affects me. This is what happens. It's a little bit unpredictable. Sometimes I might ask for an extension. Sometimes I may have to like do exams past exam time. Like I try to kind of be proactive and kind of try and meet with a prof before the semester starts, and just so that they have like a face to the name, especially when we were online. Like I went to office hours and so forth. And I felt like that helped in terms of kind of bridging that gap in the knowledge as well. As it also helps you to, in the future, when you might need a reference or whatever, it shows that you took like proactive steps to like meet your prof and go around like barriers that could come in the future.
Yeah, just to add to what Gina said, I really like the points you brought up, because what I really see is that, like, as students, we interact with many different people. I mean, be it other students, be it like faculty members or staff or like academic advising, we interact with many people. And each time we interact with them, it's really an opportunity to educate them about our condition and how it may affect us. And it really seems to me like Gina took the opportunity to do that. And doing so proactively, as she did, also leaves a positive impression upon those people that are teaching us. So I really like the points that you mentioned.
Thanks, Steve. Could I ask one question to the panelists? Is it ever too late to ask for the accommodations? I think Steve had mentioned he didn't request any for his first year, and it was later in his training, and James had mentioned that it can be more difficult to try and institute it after an event or a hospitalization or an illness or a missed test or something, but it still can be done. Is there any point at which it really is problematic that there's a sort of a deadline date that, you know, halfway through your degree you can't go and ask, or any thoughts on that?
In my experience, I didn't have, once I applied to kind of like my accessibility service, and I like was keeping up with reapplying every semester, I gotten extensions on assignments like the day of. Obviously, when I was emailing, like I always kind of tried not to use my extensions, but like going through the whole university, like I always opt just to kind of say, like, it's better to ask for an extension and not need than to not ask for it and you needed it. There's been times where I've been like cramming, trying to get the paper in, and I'm like, it's not working. I start feeling myself like feeling a little bit down or something, or like I can feel something coming on, just stressing about it. And I would just like, okay, I need to be proactive in this. There's no rush, because if I force myself to do this and I get ill, then I'm going to be paying more in the long run. So I always be like, email my prof saying, I'm sorry, I know this is last minute, but I'm kind of going through it. I need the extension out like tomorrow or the end of the week. And they're usually flexible. I would always try and do it kind of like maybe a week before, if you know you have a lot of papers due or something, or a lot going on, maybe a few doctor's appointments, just kind of reach out like maybe a week before. Because if you reach out earlier, they like that more, because then it's not so last minute. But like if you have to do it last minute, some profs will be understanding. And like, again, always kind of try and do it beforehand, but if you have to do it last minute, it's okay.
It's true. Just to add to that, I guess there's multiple ways of answering the question. What, is it ever too late to set up your accommodations? No. I think I set mine up like second semester. But like using them for missed work, is it ever too late? It can be, to a certain degree, depends on the goodwill of your professor. Usually, rule of thumb, you want to ask for an extension or mention your accommodation before the due date of the assignment. It's really hard to do it after the assignment has already been due. If your professor is really, really nice, they can do it, but that'll kind of be more up to them. And even if they do decide to give you an extension after the due date, because they're really kind, when you're trying to make up for missed work, of course, you only have until the semester is done. So you can't go back and say that you were ill, you couldn't complete any work after the semester is done. So I think sometimes it's like December 9th or like early April. So those are just things to be mindful of. Always, please talk about it for the due date.
Thank you both for some great answers and really lots of insights and for sharing your experiences. And we're going to invite Landry back to continue with the rest of the session.
Well, without doubt, I believe we have been empowered by the presentations from Dr. Dorish and Mr. James Bradley, and great insights we have gotten from Steve and Gina. This is really amazing. And I'm hoping that the knowledge that these wonderful individuals have imparted to us today will support those who are still in post-secondary or who are thinking about post-secondary to be successful in this, in their journey. I have really learned a lot today. I want to thank again our presenters, James Bradley, Christian Dorish, Steve Kindle, Gina Mitchell, and I also want to thank our moderators for this portion of today's event, Dr. Susan Williams and Marie Pascal-Poco. Now, I noticed there is still a question in the Q&A, so I want to encourage everyone to keep on adding their questions. What we will do is we will take these questions and we will post it to the appropriate presenters, and we will share the, the answers with you. So keep on putting your questions, in the Q&A and your email address, and we will make sure that we get back to you. We want to be mindful of the time and make sure that we conclude all of the program today by 1 p.m. So now to the fun part. We're going to go to the awards, and I think we've all dressed nicely for this part as well. So if I may ask everyone just for 1 hour to kindly put on your camera, and our great media coordinator, Carla, will take a screenshot of everyone, and then we can move on to the second part of today's event. Thank you.
Everybody give me a big smile. Okay, perfect. Thank you.
Thank you. Thank you very much for that. Without taking more of the time, we're going to go to the second portion of today's event. Again, on behalf of the Board of Directors of the SCAGO and the management team, we'd like to welcome you, all of our guests today, and the recipients of both the Sunday Hafalabi and the Sholapi Animation Scholarship Grant to the Scholarship Grant Award Ceremony. So briefly, the agenda today, we'll talk a little bit about the history of the awards. We introduce the recipients, and they will give us about 1 minute, speech, and we will basically close. So just a little bit of history around the awards. In 2005, when the Sickle Cell Awareness Group of Ontario was established, it was actually established in memory of a young man, Sunday Afolabi, who was an accomplished engineer and did not let sickle cell disease deter his educational goals. And when we established the organization, we decided to honor his memory because we know the value that he places on education by establishing the Sunday Afolabi Scholarship Grant. Since the grant was established, we've granted about 40 youths with the scholarship and provided over $45,000 in grant fund. Similarly, in 2010, the Sholapi Animation family joined SCAGO in ensuring that individuals with sickle cell disease excel in post-secondary, and they established the Sholapi Animation Scholarship Grant for youth with sickle cell disease. Since 2010, this exceptional family has granted over 14 scholarship grants to youth with sickle cell. And I want to just applaud this family, the Animations family, and thank them for joining SCAGO to fulfill SCAGO's mission of improving the quality of life of individuals with sickle cell disease by ensuring that one of the barriers, which is financial, that could deter an individual from pursuing post-secondary education, is taken care of. And without taking much more of your time, I would like to welcome and introduce Ms. Doreen Alexander, who is the vice chair for our board, to do her the honor of introducing and presenting the Sunday Afolabi Scholarship Grant. Ms. Doreen Alexander.
Good afternoon, everyone, and thank you, Ms. Lanray, for that presentation. Thus far, it's been awesome, and I thank the panelists and all the presenters for doing such an awesome job. So we have in front of us this lovely young man, Isaiah Edwards, and I'm going to tell you a little bit about Isaiah. Isaiah is a former student of the J. Clark Richardson Collegiate in Ajax, where he graduated as an Ontario Scholar and Honor Roll student. He received the Student Recognition and Service Above Self Award and was nominated for the class of 2021 valedictorian. Isaiah has served as an active ambassador for the Hospital of Sick Children and Camp Jamoki for over 15 years, participating in national and international awareness campaigns highlighting sickle cell disease. He has used these platforms to share his personal experiences living with sickle cell disease, his hopes for improvements within the healthcare system, while acknowledging the mental and physical strengths required to live and persevere with sickle cell disease. Isaiah is currently attending Centennial College, York University, where he's working towards his liberal arts degree. Isaiah is honored to be a recipient of the 2021 SCAGO Sunday Afolabi Scholarship, and the Sickle Cell Awareness Group of Ontario is pleased to offer Isaiah the Sunday Afolabi Scholarship Grant to support his 2021 academic year. Congratulations, Isaiah.
We will call on Isaiah Edwards to give a 1-minute speech. Isaiah.
Hello, everybody. I'm going to make it quick, sweet, and short. Thank you guys for having me here. This is a huge honor to be recognized by SCAGO as a recipient of this award. And I thank you for the continued support of everybody here, everybody who's not here, and everybody who made it possible for this award to happen, because we have to show recognition to them too. Because as I said, we wouldn't be here receiving this award. Us as the recipients wouldn't be here receiving this award without the people of the past. So thank you to them. Thank you to the SCAGO organization again, and thank you to everyone who supported us.
Isaiah, if I may add to it, we'll say thank you to Mom, because your mom has been a tireless advocate for individuals with sickle cell disease for so many years. I know Kay is on the line. We want to thank her also.
Yeah. Mom, come. Let people see you. Come, Mom, come. Shout out to this beautiful lady right here. I wouldn't have been able to do it without her. She's been with the SCAGO, supporting them from before I even knew what was happening. So she's honestly probably a bigger part of this than I am. But, you know, again, thank you for everybody. My minute's up, but yeah.
Thank you, Isaiah. Thank you so much. Lovely young man. Congratulations again. So,
Next, we have this beautiful young lady, and I hope I'm pronouncing her name correctly, Obihi Yumolu. She was born in Nigeria into a family of 4 kids and diagnosed with sickle cell at 6 months old after the death of her eldest sister who had sickle cell anemia. Her sister's death took a big toll on the family, who moved to Canada when she was 6 years old. With the benefits of the Canadian healthcare system, she was able to succeed in school and is now going into her 3rd year in psychology, a field she is passionate about. As she so quoted, "It will help me improve the lives of others," said Obihi. She enjoyed giving back to her community, which is why every summer she volunteers at the African Community Services of Peel, a nonprofit organization that caters to Black Canadians and immigrants. As she continues through life, she hopes to use all she has learned in school and life to better the community she loves. The Sickle Cell Awareness Group of Ontario is pleased to offer Obihi the Sunday Afalabi Scholarship Grant to support her 2021 academic year. Congratulations.
And we will call on Obihi Yumolu to provide us with her 1-minute speech.
Hi, I just wanted to say I'm really grateful for this scholarship. It really will go a long way into helping me achieve what I want to do in the future. I'm very grateful to my mom, who has always been there for me whenever I was sick. She's always been my primary caregiver. My dad, who also supports me when I'm sick, and my sisters and brother, who are, again, always there to take care of me when I'm sick. Even though they're younger, they still look out for me like I'm the youngest. I love them very much. I love all my family, and I'm very thankful, very grateful to SCAGO for this opportunity. Thank you.
Thank you, Obihi. Thank you, and congratulations again. Without taking much of your time, I'd like to introduce to you Ms. Amina Animashaun. Amina Animashaun is the daughter of the late Shalapi Animashaun, who has provided, in her memory, the family has provided about 14 scholarship grants. And we are grateful that this year they are also providing scholarship grants to 2 individuals, Brumi Aror and Tega Aror. Without taking much time, I would like to introduce Amina Animashaun to provide us with a speech, and also to introduce the Shalapi Animashaun recipients. Thank you.
Good afternoon, everyone. My name is Amina Animashaun Arigbabu, and as mentioned by Ms. Langray, I am the daughter and firstborn of the late Shalakbe Animashaun. We would just like to thank SCAGO for allowing us to use their medium to honor the memory of my mother, but also to support students. My mother didn't have sickle cell anemia, but she did work in hospitals. She was a nurse here in Canada for a few years before she passed away. And one thing she always found to be very important, just like the late Sunday Afolabi, is that education is important, and that no matter a person's financial or health state, they should have access to education. And that's why we chose to honor students with a little bit of something to get them through post-secondary, because as we all know, if there's anyone who has studied here in Canada, it's extremely hard, and to go through it with a health condition makes it even harder. But I definitely want to commend everybody on the call today, those who have sickle cell, those who are family of people who have sickle cell. You folks are absolutely amazing. You are a beacon of light, and it's an honor to be here with all of you today. So first up, we do have Brume Era, who is a first-year student at the University of Toronto, Mississauga, studying computer science. Though sickle cell disease is a particularly burdensome and disruptive disease, Brome has determined to make a significant contribution to society. Prior to the pandemic, he volunteered quite often in his local church, helping the adults with taking care of children in the children's ministry. In the same church, he was actually the male valedictorian of his coming of age class back in 2016. So upon graduation, he hopes to pursue his dreams of becoming a fully fledged software engineer and establish a company that helps people better manage their health after gaining valuable experience. The Sickle Cell Awareness Group of Ontario is pleased to offer Brome the Sholakbe Animashaun Scholarship Grant to support his 2021 academic year. Please help me in welcoming Brome.
Thank you.
Thank you. Well, I want to thank SCAGO and Mrs. Animashaun for providing me with the opportunity to pursue my post-secondary goals. It is especially challenging as an individual with sickle cell to stay afloat in regards to my education, and I believe it is wonderful that there are foundations like SCAGO that seek out and invest in people like me and help me achieve my goals. And I also want to thank my family for lending their unconditional love and support. I'm grateful that they were and are with me in every step of my journey towards achieving my goal of becoming a software engineer. Thank you all so much.
Amazing, Brome. Amazing, Brome. Thank you so much for that wonderful speech. And we're very proud of you and every one of the recipients today. Thank you. Without taking much more time, we go to our next recipient. And Ms. Animashaun will introduce her as well.
Yes. Next up, we do have Tega Ero. Tega Ero is an undergraduate music student at the University of Western Ontario, specializing in voice performance at the Don Wright Facility of Music. From childhood piano lessons to collegiate a cappella competitions, she has loved participating in the performing arts. Tega values her identity as a storyteller just as much as a performer. Her favorite music, literature, and film and television will always be those that depict a compelling story. Tega was diagnosed with sickle cell disease when she was 3 years old. Although it sometimes felt like sickle cell was slowing her down, Tega never let it stop her from pursuing her interests. In the future, she plans to share her abilities and talents in music with as many others as possible. She likes to believe that seeing things is how she focuses on her ability, instead of her disability. The Sickle Cell Awareness Group of Ontario is pleased to offer Tega the Sholakbe Animashaun Scholarship Grant to support her 2021 academic year.
Thank you. And we have Ms. Tiga Haror speak.
Hello, so my name is Tega Ara. I am Bruma's older sister. And I just want to thank, on behalf of both of us, I just want to thank SCAGO. I want to thank the Animashaun family, all the panelists and recipients and attendees here today. It's an honor to be able to spend this time with all of you and talk through kind of what is a really big part of our lives. I do agree with Ogina that it's a good idea to just kind of talk to the people in your life about what you deal with, because then that helps to raise awareness and it helps let them know like what is happening to you. And honestly, like I don't really talk about this kind of part of having a chronic illness that much, but like it can really feel like you are peering into a black hole, into an inescapable black hole that can consume you when you have chronic pain and chronic conditions. But I think the silver lining is that organizations like SCAGO and people that help you and accessibility services are the light in that black hole that, you know, can help you live a full life. So I just want to thank you all for being the silver lining and for being the light in what I often consider, you know, is peering into a black hole. I want to wish everybody here a great weekend and a great degree, whatever it is that you're pursuing. And I hope to see you again in the future in some other sickle cell awareness events. Thank you.
Very nice. Nicely said, Tiga. Thank you so much. And congratulations again. It looks like we have about 5 more minutes. So before I do the closing remarks, I believe there was a question, Dr. Susan, that maybe in the Q&A box that maybe we want to address quickly. And then we can move on to the closing remarks. Thank you.
Actually, just want to say that I did have an opportunity to send a question over to Dr. Jurish, and
okay,
I just copied and pasted her response to the chat, the Q&A chat, and so the individual was able to, I think, should be able to access the response from there.
Thank you so much, Ms. Poku. So without taking much more of everyone's time, it's been an amazing, 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 amazing event today. So on behalf of the Board of Directors and the management team, I would like to thank every one of our guests today. I also want to especially recognize our Chief Financial Officer / Treasurer of the Board of SCAGO, Ms. Moji Ogunsoya, who has also joined us today. Given that this woman has a day job and the amount of hours in a day that she also commits to SCAGO Financials to ensure that we are always, right with the CRA, it's just amazing. And we want to really thank everyone that is helping SCAGO to fulfill its mission in one way or the other. I believe that today has been a great experience for every one of us. And myself, I gain a lot from our young people. I am inspired by their lives. I mean, these are brilliant young people excelling academically, and we are proud. We are so proud of you. And we know that you will continue to be high achievers, and you will not let sickle cell disease or any challenge deter your goals in life. I would like again to thank our moderators, Ms. Poku and Dr. Susan Williams, for the great job making today to flow very well, and we're just right on time. And also to thank our presenters, amazing job with the mental health by Dr. Durish. The presentation has also allowed us to know that we need to be here now. We don't have to put too many things in our basket. We need to focus, and so that we can reduce the stress of life. Every year, every time, James, you are my partner in crime, if I may use that word. We have done so many sessions together to support transition. And I think it's something that is very dear to SCAGO. And I want to encourage everyone, parent here and every young person, to say, if you're having challenges, in ensuring that, your school supports your transition, you can reach out to James. You can also reach out to SCAGO as an advocacy organization. They've supported a lot of students through this, and we have been able to present to their school. So we have these services available for you. Reach out to us. We are here to help you. And I also want to thank Ojina and thank Stephen, who has over the years, provided their insight to support other students who are also either in post-secondary or thinking of post-secondary. Again, I want to thank every one of you. I want to congratulate our recipients again, and I want to wish you a very, very wonderful weekend. Thank you, everyone.